So we have on a construction site created a meniscus tear, so there's a lot of general swelling that was here. It actually went down from the last visit about 50%, but you can see all the swelling in here. And as we push down into it, it fills up the capsule more. So what we do is it's more on the medial side, plus, so I'm going to come in this side here, and we're going to adjust the knee, get along the joint line, and we're just feeling we're taking it through motion, and it's actually moving a lot better, right? Better. Ask him how it's doing since last time.
¿Cómo se ha
Last
sentido
time.
desde el-
No, mucho
otra vez?
mejor.
Sí, much better.
Much better, okay. So, you can feel this clunk right back in there. So this was a little bit. Swelling's down, it's moving better, it's better alignment in that meniscus. So the tear in there is not fixed, but it's in better position, so he's getting extension once again. So what we're going to do is we're going to adjust his low back, get a good nerve supply down into this leg, so it stays strong. Then we're going to actually adjust his neck too, and then we have a little rehab exercise just to open up the joint, to allow the synovial fluid to bathe that area, to heal it. So we just have to continue that for about 6-12 weeks so it can regenerate and heal that cartilage. All right, so let's have you lie on your side facing me. So I'm going to come in here because you can't flex as well because the swelling in there still. So we're going to just keep the leg here. L3, right there. L3 goes to the knee. So he's getting a good nerve supply down to the knee area. Let's go to boca arriba. And now we're just that there, perfect. So the brain can talk to the rest of the body and balance the body, because when that body's in balance, it's going to get stronger. So now what we're going to do is we're going to have you sit up, right, siéntese aquí, and we're going to put some ankle weights on. So typically, are they in here? Yeah. Okay. Nice bag. Got everything. All right. So this looks like it's about, is that 3 pounds?
I think it's 3 pounds.
3 pounds, okay. So you may want to do more, a little more than 3, but we're starting off
I
with
want to
3.
take them.
So we're going to do both sides, so you can work both of them as he's doing this. So we're just going to wrap this around the ankle. Let's see. That. Gonna do the other side. Okay, so we're going to scoot a little to this way. This one.
Te va a mover un poco para el lado
Okay.
derecho.
So slide this way more.
Todo tu cuerpo.
There you go. Now, what he wants to be doing is he just wants to do a nice swing like this. He's getting distraction from the weights that are pulling down, opening up that joint. So it's going to be able to allow that meniscus to get bathed with all that synovial fluid, because synovial fluid's like super filtrated blood, and it's bringing in nutrients, and it's going to pump out the waste products, so it puts in a healing environment. So he wants to come in here and just do like this, okay? So you want to do that try to do that for about 20 minutes. All right, just like that.
Okay.
And so you want to try to do that twice a day for now. And then what we'll do is we'll recheck that in a few days and see how it's going. But already the swelling's gone down quite a bit, and he's gotten a lot of motion back in that since we adjusted it last time. So, so we want to get a little heavier here as we go. We'll get up to about 5 pounds, and doing great. All right.
Okay.
Okay. Good. One thing I want to add is that when you have those type of joint injuries and you want to repair and regenerate the cartilage and heal it, is that you have to stay away from things that are going to interfere with the healing. So for example, one thing would be medications, because if you're in pain, you're going to take non-steroidal anti-inflammatories, or maybe get a steroid shot, but that will actually interfere with the actual process of the regeneration of the cartilage. So during that time, if you have to use any type of anti-inflammatory, you can use ice, but then heat will work really well once the acute episode's over. So when in doubt, ice.